Thank you for tuning in to learn about safe infant sleep with the Safe to Sleep campaign. Safe to Sleep is a nationwide effort to educate parents, caregivers, health, and other service providers about reducing the risk of sleep-related infant death. Joining me is pediatrician Dr. Rachel Moon, a leading expert on sudden infant death syndrome, or SIDS, and safe infant sleep.
Thank you for inviting me to talk about this important topic.
Dr. Moon, as you well know, one common question among caregivers is, how do you safely keep a baby warm and comfortable while they sleep? The 2022 AAP recommendation says, avoid overheating and head covering in infants. Could you please talk us through the reasons behind the recommendation and suggest ways for parents and caregivers to practice it?
Absolutely. Research shows that babies who get too hot are at higher risk for SIDS. And there are two potential reasons for this. One is that babies' bodies are just learning how to control their temperature, and it could be that once they get too hot, they can't cool down the same way adults can. Or the body system that keeps them breathing doesn't work as well when they're too hot. The other potential reason is that blankets and extra coverings that are used to keep babies warm can be a suffocation risk. So the AAP recommends that instead of using loose blankets, you use a wearable blanket for the baby, or put extra layers of clothing on the baby if you're worried about them getting cold. And this is a new part of the recommendation. Babies shouldn't wear hats indoors. Hats are not needed inside for most babies once they come home from the hospital, because hats can make baby too hot. And there's also the chance that the hat can cover the face, particularly the nose and mouth, and make it harder for the baby to breathe. So when dressing the baby for sleep, we want the baby to be comfortably warm, but never hot.
Thank you, Dr. Moon. Let's dive a little deeper into that advice. First, I would love to hear a little more about what caregivers should do when dressing baby for sleep.
Of course. So you start by thinking about the temperature in the room where the baby is sleeping. The AAP recommends that babies sleep in the same room as their caregiver or caregivers until they're 6 months old. So let's use that as an example. What would you wear to be comfortably warm in that room at the temperature that your room is at? You want to dress your baby in at most one more layer than you would wear to be comfortable. So if you would wear a long sleeve t-shirt to stay warm in your bedroom, you may want to dress the baby in a long sleeve t-shirt over an undershirt. Dressing the baby in too many layers is called overbundling, and this can cause overheating, which is when the baby's body temperature rises to a level that could be dangerous. Remember, babies are only just learning how to control their bodies, so to balance keeping the baby warm but not too warm, dress them in at most one layer more than you would wear to be comfortable.
And just so we're clear, if baby does get too warm, what would that look like?
An overheated baby might be sweaty, clammy, or have warm, flushed skin. If the baby's chest is hot to the touch, that's also a sign of overheating. These are important things to look for so that the caregiver can help the baby cool off by removing a layer of clothing or moving to a cooler area.
Thank you. That's helpful advice. It's good to know the signs of overheating so we know what to do to keep baby safe. To learn more, visit the Safe to Sleep website, linked in the description of this video. And remember, when it comes to baby sleep space, keep it bare, keep it safe, keep it simple. Thank you for joining us. Bye for now.